Good morning, everyone. We're going to go ahead and get started. My name is Tiara Labrada. I'm a senior policy analyst with the Supportive Housing Network of New York. Thank you all for joining us to this presentation of the new redesign of the Coordinated Assessment and Placement System. We are so happy to have Craig Retchless, who is the Assistant Deputy Commissioner at CAS, and Robin Pagliuco, who is the Director of Coordinated Entry. They'll be talking to us about the redesign of the PACT system, which is now called CAPS, and giving us a deeper dive into the housing provider functions within the system. They're going to do about a 30-minute presentation and then open it up to Q&A. Everyone is muted, everyone's video is off. If you have any questions, please put them in the chat. We'll be monitoring the chat, and we'll be answering your questions at the end. So without further ado, I know we have a lot to cover today. I'm going to pass it along to Craig.
Okay, thank you, Tiara. I really appreciate that. And I want to thank the network for providing Robin and I the opportunity to present our system to your membership. And I also want to thank people in advance for taking time during these challenging times to learn more about our system, and we hope that you find it informative. And as Tiara said, there is you can submit your questions in the chat, and we'll be monitoring that and trying to answer in the chat function. But also, we have time at the end where people can, really start to submit more questions after you've seen the entire presentation, if that works for you better. Okay, so I'm going to get right into the presentation here. Everyone knows who I am. After Tiara's introduction, I'm Craig Retchless, Assistant Deputy Commissioner at HRA, Customized Assistance Services. And so Coordinated Assessment and Placement System is what we are now calling the system that you probably know as the PACT system. And so what we decided is to call everything in our system CAPS. And we're going to be going into that, all the details of the new functionality in the system. This is somewhat of a branding exercise. So we're hoping that people then will refer to our system only as CAPS, not as not as the 2010E or the PACT system or other names that we have gone by in the past. So we appreciate that. And let me get into the agenda of our presentation. Okay, so today we'll be covering what is new in the system. And for people who are new to our system, there are several components of the system. So we have the survey, which is an assessment tool for clients, an assessment and engagement tool for clients that you're working with, who are individuals and families who may be experiencing homelessness. That's one of our targets. And so the survey helps you with that. The application, which is the New York City Supportive Housing application, that is the tool that we use to assess if people are eligible for the supportive housing offered in New York City. And then we have a referral and placement component, which is about placement entities that will create, select clients to refer and place to your program, based on eligibility and other factors. And then we're getting into a new function of the system, which is vacancy control, and that is something that placement entities placement entities as say HRA placement, Jennifer Kelly's shop. You work with them if you have beds that they're referring and assisting you to place in your supportive housing. And then we'll be going over the new system training and access. So that is our agenda. So I'm going to be taking half of the presentation related to the survey and application, and then Robin will be joining us to take over the next half of the presentation. So let's get into it. Here we go. Okay, so, sorry about that. So this slide is, this is, what the process looks like. So there are a lot of folks that may not think or know you're utilizing the CAP system. So this slide explains the process from access to the system to the placement of your client into the supportive housing. So, some people may be like, what is CAPS? I've heard of it, but I'm not sure if I'm using it. So we're hoping that by going through the entire process or the workflow here, you'll understand that better if you don't already understand it. And maybe this will raise some questions for those who are knowledgeable of the system. So the beginning point of CAPS is when a user, and why don't we use the example of like a case manager or housing specialist in a DHS contracted shelter who may be working with an individual or a household, like a family, to help them to resolve their homelessness. So the first step would be that they engage the client and complete the coordinated assessment survey, which is a basic questions about the household, like income, their employment, health or mental health issues they may be experiencing, whether they're a veteran or have had experienced domestic violence. These type of things which will help in the coordinated assessment survey tool will help to assess whether the individual or the family, head of household in the family is potentially eligible. And so this survey takes people under 30 minutes to complete. And we've received a great deal of positive feedback from our pilot groups that it's a great engagement tool with the client. And so they use it in that way of service planning for the referral and placement process. So determining whether what is the path that is, the client's preference for resolving their homelessness. And then you'll see that there's a down arrow. So all of the middle tiles explain the path to supportive housing. You'll see the main tiles in the middle. And then there's a down arrow which explains other paths to permanent housing, mainly for folks in the shelter system that are potentially eligible for state and city rental assistance programs. So these could be other results that you get in the survey. And then depending on where the client is, like the setting that they're in, then the caseworker or the housing specialist would work with them on that path. So we're going to be talking mostly about the supportive housing path. So the user completes the coordinated assessment survey, and then they get the results. They get a result for supportive housing, and it will give the actual category of supportive housing. Everyone knows that there are multiple, there's so many supportive housing categories. New York 1, 2, 3, now New York City 1515, all the different populations of that initiative, and then the state initiative, which is, we're calling ESHI. So all of that is programmed into the survey. And so as I said, the worker engages the client around that. And then once they've completed the survey, they get the result for the supportive housing, and with a touch of the button, they are then they can then start the supportive housing application, which is pre-populated with information from the survey. And so then once they complete the supportive housing application and transmit it, it goes to HRA, the PACT unit, and they determine what is the actual eligibility of the client. So survey gives potential eligibility. It's kind of like a way of getting a heads up on what your client may be eligible for. And then the PACT team actually reviews the application, which takes a little bit longer than the survey, and makes an eligibility determination, and also makes a determination on the standardized vulnerability assessment. Now, I'm not going to go into too much detail on that, other than it is a tool that we have developed to measure the client's level of vulnerability, and it can be used as a mechanism for prioritization. So once the client is eligible for supportive housing, they are then in the system, and the HRA can, the HRA placement unit, Jennifer Kelly's shop, can then select the client and then match them to an appropriate unit that they'll be eligible for, in the system. And we're going to be going into a lot of detail about this later in the presentation. So they would use our system to match the client, and the system also helps them to match the client based on their eligibility, the client preferences, prioritization, and the SBA determination. So that is that with, hopefully that's a comprehensive explanation of what the process looks like, and you will know whether you're in the CAP system or using the CAP system or not. All right, next slide. All right, so this slide really is about why we are doing this and how it's been implemented. So, why we are doing this is because coordinated entry is a HUD mandate. New York City receives a great deal of money from HUD through, Shelter Plus Care, ESG, all of this funding. And you know this if you are part of the New York City continuum of care or have programs that are funded by these HUD programs. And so this is a federal mandate. But what's great is that HUD does provide a lot of latitude for communities to determine their specific needs. So the continuum formed the CAPS committee. I think this year we celebrated our 5-year anniversary. And so we've been at this for a while, really trying to perfect the coordinated entry process. What does it look like? And how are we going to implement it in New York City? And so the CAPS committee is a collaboration of government agencies, membership organizations like the network, and nonprofit provider community. So a lot of different providers that are on that committee. And so that committee is an active committee working to make the CAPS system or coordinated entry system work for homeless individuals and those at risk of homelessness. And what our favorite saying is, the system is iterative. So we're constantly looking at the system, reviewing the process, the system, to make improvements that we have, that, you know, people on the committee, but also other stakeholders. HRA has sponsored many different pilots, and a lot of people maybe even on this webinar have been participants in our pilots, and we have learned a great deal from the community. So we do feel that the system is community driven in terms of its development. Okay, so let's get into so now we're going to be talking about the system. So this section, the New York City Supportive Housing Application section, is about the survey and the application. So these are what we call referring agencies that are completing the survey and the application to see if their client is eligible for a supportive housing category, right? So think about it in that context. All right. So this slide, you'll see at the bottom, it's a kind of a preview of what our system. It's not going to look exactly like this. This is an example, but it is going to look similar to this. And so one of the changes in the system is that we are requiring the coordinated assessment survey to be completed prior to submitting a supportive housing application. And the reason why we did that is to, one, streamline the process in the system, but also the benefits to the worker and the client, we feel, are so tremendous in terms of the system returns financial and identifying documents that HRA has on in our repository system. So if your client has had contact in the applying for public assistance benefits, cash assistance, that kind of thing, they have to supply certain documents to prove their eligibility. Well, we pull those documents into the system. So we've heard a lot of great feedback on this is very helpful in the placement process because as you know, when you go to place somebody, or if you're a housing provider, you require these documents in order to place clients into your supportive housing programs. The survey also returns prior supportive housing applications for the last 5 years. I think that this is great. Before the survey, we did not have this level of transparency in the system. And so what that does is it gives the worker more information about the client if there's a match on a prior supportive housing application. And so they would be able to see where they were applied, the psychiatric evaluation, the psychosocial documents. Really what you think about this is that it gives you a tremendous history on the client. And a lot of our clients are not very good historians and may unintentionally omit parts of their history that are applicable. And so this is really important in terms of like determining what their needs are and what the path would be for them to resolve their homelessness, or if they're at risk of homelessness. There are surveys returned to you that were completed in the last 6 months. So you could take a current survey and act on that if you think that it's a good assessment of your client. And then of course, it provides those results on supportive housing categories and rental assistance programs. And as I mentioned, when you press a button, it will jump you to the supportive housing application when you've completed the process of the survey, and it pre-populates sections of the application for you, so you're not double entering. So we're constantly thinking about improvements and streamlined process for the users in our system. Okay, so the next thing you can anticipate in our new PACT system is that in our system currently, you have to kind of toggle a lot between different functions of the system. And so what we did was we integrated a lot of the information that the survey returns into the application process so that you would have access to it more readily. Everything is in one place so that you can tab between the application and also the documents that were returned on your client if you want to utilize those to improve the application for the individual or family you're submitting for. And so we're hoping that you find this to be an efficiency if you're a user in the system. Everything is built to try to, improve the application or streamline the process so that it doesn't take as long, because we all know that time is valuable. All right, the next slide is an exciting function. I'm very excited about this because this is brand new. We haven't had this before. So while you're completing the application, you will have a tab in the system that you can retrieve housing documents for. So say your client has had a prior supportive housing application from, say, a street outreach program, and they submitted a letter verifying, a homeless verification letter in that application. In the new CAP system, you would be able to see that there are housing documents in the prior applications, and then it also gives you a function to basically click an arrow button to upload that into your current application. This will be a big time saver for folks because this will, if the client mentions that they had some street homeless time, the way that we normally did this is that you would, the referring agency or referring worker would need to contact that outreach program and get a copy of that letter. Or you could get it in our survey, but you would have to you'd have to look through the prior supportive housing application. There was no indicator whether it had a housing document or not. We're taking that process and streamlining it so that you can really give a complete housing history and homeless history on the person that you're submitting an application for. And this really impacts their eligibility, as you know, to be able to document those things. So excited about that function, and hopefully you guys are excited about it too. All right, so this is really just a reminder slide. So sometimes we do some enhancements or policy changes related to submitting a supportive housing application, but the word doesn't get out. So get the word out on this. Look at all the professions that now can complete a psychiatric evaluation for the supportive housing application. This is amazing. I mean, I don't know if I may be dating myself here, but I remember when I was doing the application in my younger years as a caseworker, and HRA only accepted from a licensed psychiatrist. That was the only profession that could do it, and that limits really limits the client's access to professionals who can conduct this assessment. So as you can see, we have a variety of professions and competencies that can complete that assessment now. And so this is a reminder of all of those. And our latest iteration just came out. We expanded to 4 new professions. You can see them there on the slide. That happened in April of 2020, so very recent, but we wanted to advertise that again here in this presentation. So I will go on to the next slide. So we have been working with the state organization or state agencies on providing ESHI, which stands for Empire State Supportive Housing Initiative, eligibility determinations in the new PACT system. So this is great because for providers who have ESHI contracts, you will know that in New York City, we've had to kind of come to an agreement about what meets the eligibility. Well, those days are numbered. As soon as CAPS launches, the application will make a determination for ESHI categories for mental health and substance use populations. Now, there are other populations in the ESHI world. We're not doing all of the different populations that ESHI addresses, but we are doing it for the mental health and the substance use populations for single adults, families, and youth. So look forward to that. And as always, we're not just doing eligibility determinations for ESHI, we're doing eligibility determinations for all the supportive housing categories. So you submit the application and we will review for all the different supportive housing categories at HRA. Okay, so this is also a little bit of advertising on functions that currently exist in the system, and we're carrying them over into the new CAP system. So this is a little bit of advertising again of what the system can do, just to make sure everyone is on the same page, in case you missed it. So the application pulls the last 4 years of homeless histories from the care system. That's DHS singles and families, and the HACA system. So you'll see in the application, there's a new like housing and homeless grid, which will populate and show you time that if you're the person that you're working with has had homeless time in either of those systems. The application also pulls in the last 4 years of housing history from prior supportive housing applications, which is great. So if we have counted homeless time and that kind of thing, you'll see that reflected in the homeless and housing grid. And then the referring agency, housing provider, upon referral and placement, can also add documents after this is post-determination. So you've submitted the application, you've gotten a determination. In our system, you can go back to that determination as long as the approval is active. So you go into that application. You can add documents so that you can share those documents, say with a placement entity or the supportive housing provider when the placement entity makes a referral to them. So that's a great thing because everyone can be looking at the same document, and it's a nice, easy, secure way of sharing very confidential information. And then it will display the expiration date and prompt application save. So we, with all the new functionality in the system allows for you to save an application for up to 30 days. And so there is kind of a countdown on like how long you have until you complete that application to make sure that the information is current. And then of course you can use the mental health report. Some people don't know about this, it's always been a part of the system where instead of attaching a psychosocial assessment and psychiatric evaluation, like the actual documents, you're actually using a form in the system, data entering information that you have on your individual, the psychiatric evaluation and a psychosocial assessment. Basically, you mash those two up, fill out the form, and sometimes this is good when there are problems with actually the legibility and things like that of the assessment itself. So that's a great feature that we're carrying over into the new CAP system. All right, so this is the time that I am turning it over to my wonderful colleague, Robin Pagliuco, who is Director of Coordinated Entry, and I will leave it at that. Take it away, Robin.
Thank you, Craig. I really appreciate that intro. Good morning, everyone. My name is Robin Pagliuco. I'm the Director of Coordinated Entry at HRA. I want to thank you, Craig, for that really detailed explanation about the survey and the application. For those of you who were rapid fire submitting questions in the chat, I answered what I could, and then I did flag some that we will come back to in the Q&A that we'll have at the end of the presentation. And Craig really talked about the changes in the CAP system as it relates to the survey and the application, right? So for those of you that are doing applications on behalf of your client, this portion of the presentation is really focused on the housing provider piece, right? How is the system going to change for those of you who are supportive housing clients? So Craig, if you could advance to the next slide. There's a really significant shift in the way that we are categorizing units within the system. Moving from a contract-based system that does not track unit level detail to a system that does track unit level detail. And another huge feature of the system is a dashboard, right? So you log in, on the left-hand side, you could see the survey, you could see the application system, you could see the vacancy control system, which is going to give you access to your unit roster, your tenant roster. You have the ability to maintain your agency and site information. And you have key stats that will call your eye to something that's overdue, right? Everybody's familiar with the TADs, the turnaround documents that you submit every month to HRA, indicating the occupancy of your program, right? And you get those emails saying when they're late, and then my staff will reach out to you. So now you can see upon landing on your dashboard, if you have an overdue TAD report, or if you have a referral that you've received that you haven't responded to. So this is a really helpful way for you to manage your workload within your agency. Craig, can you go to the next slide? I know that Craig is busy answering a lot of questions in the chat right now, so I'm going to try and give you as much of a heads up as possible. So one of the great features, as many of you know, when you're adding a new program, you have to go through this process, right? You receive a form in Microsoft Word, you then fill it out, you return it to us, we review it. There's a lot of email back and forth. What you can do in CAPS is you could request a new site directly in the system by filling out these simple questions that are directly in the system. And then that comes to my unit, we'll review it. We may have a little back and forth if there's any questions, and then your site will be automatically available, ready for referrals, and you could start entering your primary service contract and unit detail information. And I'll get into that a little bit more in the next slide. So Craig, if you wouldn't mind going to the next slide. And for those of you, there have been a lot of questions in the chat thus far about if this presentation will be available. Yes, the slides will be available. Yes, the presentation is available. They're all currently available on the New York City Continuum of Care, or COC website. So you will have multiple opportunities to see this information. There will be additional training before the system goes live. There will be training materials. So please do not feel overwhelmed if this is the first time you're seeing this. This is just to give you a taste of what's to come, and just know that there will be a lot of training opportunities before we go live. So as I said previously, for the first time, we're really tracking unit level data, and we're tracking it by the primary service contract. What is a primary service contract? Are your units New York 3 Pop A? Are they ESHI, mental health, adult? Are they DHS SRO units? Are they COC units? Are there combinations of COC plus New York? Right now, all of you know that those combinations of eligibility, that drives your referrals, and that drives who can reside in your program, right? And still get credit for it under your contract. So the CAP system will be able to track your units based on the primary service contract, as well as real-time opportunity for you to update that information in your system. So we all know that contracts change, unit numbers change. So this will be a much more streamlined way for you to maintain that in the system with a lot of back and forth and support from myself and my coordinated entry team. These are the folks that have been doing the TADs with you thus far. No, that's perfect, Craig, thank you. So in addition to the primary service contract information that's going to help you categorize your units, whether they're New York 3 or ESHI or 1515, the system will also have opportunities to enter unit features. So is the unit wheelchair accessible? Is it a walk-up? Is it a shared unit? This will help drive the matching function of CAPS to make sure that client referrals are going to units that match their preferences and their needs. So this is something that providers, when you set up your new site in the program, in the system, or when you are logging in for the first time after we go live, you can update this in real time. You can change it in real time. And this is something that will take some time to get fully implemented, right? So we are collecting as much data as we can on congregate sites right now, because that's a static unit, right? Scattered site, we know that changes all the time. It might be wheelchair accessible this year. When your lease is up, it might be not wheelchair accessible. So that's something that's going to be constantly updated with the help of the providers that are entering this information, as well as the coordinated entry staff who are helping to maintain this information. Craig, can you go to the next slide, please? So you're going to have 3 different rosters in CAPS, right? I just talked about the unit roster, which is going to be tracking the unit level information. Is the unit 2A, 3B, 4C, the unit features, non-smoking, wheelchair accessible, is it a shared unit, private kitchen, all of that. And then you also have your tenant roster, right? So this is where your tenant is assigned to that particular unit. So when you have a move in and a move out, you can flip that unit to online, meaning yes, the unit is vacant and it's online ready for referrals right now, or offline. Yes, the unit is vacant, but it's not ready for referrals right now because we need some time to do repairs or to turn the unit over. And you can indicate in the system how long the unit would be offline for. And it will give you a prompt to remind you to flip the unit to online. And you can also update real time the outcomes of referrals. So if you get a referral and the client doesn't show up, you can keep that unit as online so you can get another referral in the system. Craig, can you go to the next slide, please? So that's sort of the back end about referral and placement. And what this really means is that, Craig, if you can go to the next slide, that the referral and placement process will continue as you know it, right? The placement entities, as Craig described, HASA, formerly DHS placement, now they're part of HRA, will continue to refer clients in the system to units that are designated online. They're going to be making those referrals based on eligibility, right? Eligibility for the unit supersedes everything, as we know in our system. They're going to be doing it based on the population of the unit, the standardized vulnerability assessment determination, prioritization, and client choice for that unit. And what I did not mention on a previous slide, but I'll get into a little bit more detail, is the scheduling function. So when providers are setting up their programs within the system, you can indicate when you're available to conduct interviews for that program. So think about a rent up, right? You're setting up your new program in the system. You indicate that Monday, Wednesday, Friday from 9 to 11, your program is available for interviews. So when the placement entity is making those referrals, they can be scheduling interviews in those time slots that you've already identified. And then, as I mentioned, the referral outcomes on your referral roster, you can indicate the outcome of that referral in real time. So either you accepted the client rejected, the client was a no-show, or you filled the vacancy with another client that was referred. And that's all designed to speed up and streamline the referral and placement process in CAPS. Next slide, please, Craig. So as I mentioned, my team, the coordinated entry team, will work with the housing providers to maintain accurate information for your agency, for your site, for your service contracts, for your units, the unit features. All of this will still be done by our team, and we'll be working with the providers very, very closely, especially post-launch, so that we can get all this information into the system. My team will continue doing the vacancy monitoring, which are known as the monthly TADs, right? We're still going to keep doing that with you. The placement entities, meaning HASA or HRA placement, will continue to do the 3-to-1 referrals for each vacancy. And they're going to follow up on any units that are indicated to be offline to work with the provider to flip the unit from offline to online when it's ready, so that they could be ready to make the next referral for those units. Next slide, Craig. Please, sorry. I mentioned a little bit about the scheduling before, but this is an amazing feature of the CAP system, is that the provider can make time slots available in the system when they are free for interviews, and the placement entity can see those time slots. So the communication between the housing provider and the placement entity is visible on one calendar space in the system for both to see. And those real-time referral outcomes can be updated in the system as well, which will just, our intention is to really cut down on some of that back and forth around interviews and scheduling and what happens with the outcomes of the interviews. Many of you update those in the system in real time right now, but in the new system, this will really be required before you can move forward with moving in the system. Sorry, moving the client in within the CAP system. Craig, next slide, please. This is a little bit more about the interview outcomes. It's a little tough to see on the slide, but the questions run from, has the interview been conducted, yes or no? And then what was the outcome? I mentioned before, accepted, client rejected, the vacancy has been filled. As we all know, if you get 3 referrals for 1 vacancy, you can only accept 1 person, right? So that's not a rejection, you simply filled the 1 vacancy with 1 client. And then what the placement outcome is. So you can choose move in, accepted but pending further documentation, and then you could select the move in date, and then enter the unit name to actually assign that tenant to the unit. Now, if you don't have that level of detail at the time of acceptance, you can fill that in later in the system. The system will allow you to do that. And then we're also collecting for the first time income information, so the source of the client's rent contribution and the amount. Again, if you don't have this information at the time of acceptance, you can move forward through the system without entering that. Craig, next slide, please. So this is a portion of the new system that I'm not going to go into tremendous detail about now. We do have another presentation that is on the COC website that was delivered specifically for HPD sub-grantees, right? So for anyone who's a COC grantee, you either get your funds directly from HUD and the annual NOFA, or you get your funds via HPD through the NOFA. So for those providers who are getting their COC money via HPD, you know that the referral and application process is a little bit clunky. It's not electronic, and it happens all outside of the system. So what CAPS is doing is we moved that referral process in the system. So you can communicate with HPD, you can attach documents, you can transmit the application electronically, and both sides can track the progress of these COC applications. So again, for more information, there's an additional presentation that's on the COC website that goes into more detail about the COC referral process. And then, of course, we're happy to answer any questions at the end of the presentation, more about that as well. So I'm going to turn this back over to Craig, who's going to talk a little bit about upcoming training opportunities, as well as access to this system.
Okay. So, sorry, we're just kind of figuring out some of the technicalities here, going back and forth between things. All right, so thank you, Robin. Essentially, what we want to do is we also want to notify people that, you know, a lot of the questions we receive is when they hear about the system is, how do I access it? And is there training? And those type of questions, which are, you know, kind of the logical questions to ask, right? And so for programs or staff that already have access to the system, we have a role in the system called system administrators, and they can actually you know, assist you in setting you up as a user in what will be the CAPS system. And so some agencies are, you know, especially large agencies have, you know, dozens of system administrators in our system who basically self-manage this function of setting up new users, you know, because it's easier than, you know, waiting on HRA. It's faster than waiting on HRA to set you up as a new user. So you will be able to continue to do that. And so that we encourage that. For agencies or programs that do, like are brand new, like had never been a part of the system or anything, you will need to contact HRA. And that this slide provides the support email that you'll reach out to HRA CAS support, and they'll help you with that process. And then, so for the, let's see, for future HRA trainings, we will be doing a lot of kind of train the trainer. Well, we're getting into late September already, and this is part of our introduction of the system. But we will also be doing, you know, some trainings in terms of demoing the system and getting people acclimated to the new system, you know, so that they can start seeing it, getting used to it, and understanding what their training needs are. And then we will also have, you know, we will have written materials. We have some videos that we're developing, and we do want to provide kind of a train the trainer sessions for referring agencies and housing providers. You know, so identifying key people in your agency that know the system currently and would be able to go take it back to your agency and because we really don't have the resources to train every single individual. So that's the purpose of doing the train the trainer sessions for agencies. So that is it on the new systems and training and access. So this will wrap up our presentation on the new CAP system. This is our contact information. So you have me, Robin, and Alethea is the Director of Supportive Housing in our department. And she wasn't at this presentation, but she's also a good contact for any of your questions around the supportive housing application. So I will leave it there, and then we have, it looks like, some time now to take questions and answers through the chat function. And I thank everyone for your time again. Let me see. Okay, maybe what I could do is I'll leave my video on. It's very hard to kind of type fast in the chat and to do the presentation. So, but I was thinking that maybe what we could do is go through some of the chat questions and then also expand on them other than just answering them in the chat. So,
can I call your attention to a question that came up while you were presenting?
Sure.
Specific to the 2010 application, and you were talking about the pre-population of information. And one of the questions was, is there information that we cannot override in the 2010 application? For example, if it's pulled from a specific system? I thought that was a good question for the group.
It is a good question, and there is information, like that is verified information coming from the CARES or the HASA web system, and so we consider that information to be accurate because it is their systems talking to our systems, which we get a daily download of that information on people in those systems. So you will not be able to override that information. We've had very few cases where people are, basically disputing the what was in like the CARES system or the, not the HASA, but in the CARES system. And so they have contacted us and we're able to assist in that way. But no, you are not able to override the kind of verified system data, but you are able to change other data that may be pre-populated. There's an edit function in that tab of the system. So that is a great question. We've gotten a lot of other questions. Maybe we can get to them. We can definitely provide the COC website. I also saw a question, someone asked when the CAP system is going live, and if we didn't mention that, I do apologize. We have a target date right now of the new CAP system launching on October 19th, so not too far away. This is part of our marketing to make sure people are prepared, like on October 19th when we launch. But we will be doing a system of notifications through the system and through, kind of other marketing materials to make sure people are informed of that. Let's see, we can provide the CAPS COC website because Robin made mention of the presentation we did for HPD subgrantees. So that would be great for you to have that link, and you could go to the it has also other resources on it. It explains like the standardized vulnerability assessment, the criteria in detail, a lot of different resources that you can take advantage of there. So we will share those with the network for distribution to everyone. And Julissa Vasquez asked if clients get selected for supportive housing placement and the client has reasons why they would not like to move into that particular facility, could they ask to continue to be identified for other facilities in the future? And so the way it works is that if they're not placed, they will continue to be referred in the system. So that's that is something that we know from Jennifer Kelly's shop, that just because a client isn't interested in one place doesn't mean that they don't have another referral that will come their way. So, but that also is contingent on availability. So, it may be a while, because as we know that this is somewhat of a game of supply and demand. And clearly the demand is much higher than the supply at all times in our system. But we're hoping with the CAP system that we'll have even more efficiencies to identify vacancies, and the other efficiencies will also speed that process up a bit for the people we're trying to serve here, right? Robin, did you see any questions that you wanted to answer?
So I'm rapid fire answering some real specific questions in the Q&A.
Okay.
I think one good question that we should share with the group has to do with TADs. And the question was posed by Eric from the Bridge. If a program currently does not do a monthly TAD report, in CAPS, are they going to have to start? And the response that I shared with the group in QA is, if a program is tracked, meaning if it's a New York, New York, or an NYC 1515 program, and currently does a TAD, you will continue to do a TAD in the new system. If you have a program that is currently not tracked, for example, an OMH SMI only, or a DOHMH high service need contract, those programs right now, they might be in our system, but they're not reporting monthly, right? So those programs will carry into our new system, but they're not going to have to do a monthly TAD report. And that's going to be a transition process, right? Where those units start to become part of the tracked units that we report on. But again, we're talking about a lot of new units in a system that has not tracked those before. So there's a learning curve on our side in terms of capacity, as well as on the provider side in terms of your reporting capacity. So the short answer is, if you're not currently doing a TAD for a program and it's going to be included in CAPS, then you're not going to have to do a TAD on that program, certainly not right away.
So there's a question from Elizabeth Cunningham that she says, I report vacancies to placement and facilitation every month. Am I going to still be dealing with that and also having to enter into CAPS? This is sounding like double work. And so what I'm interpreting this to mean is that you may have DHS SRO contracts that you're reporting vacancies probably in an Excel spreadsheet to Jennifer Kelly's shop. And so our system is supposed to be, and there may be a transition period, and I will allow Jennifer Kelly's team to make the ultimate decision on this, but there is capability for them to track it in CAPS now so that you don't have to continue to fill out those Excel spreadsheets. So we're looking at efficiencies that way. So if I got that right, in terms of your clarifying your question, that's the answer, is that CAPS should replace that process, but also there may be a transition period where getting used to the new system, maybe they will still require some agencies. I'm not sure at this point, but definitely we're working towards no double work.
Um, Craig, there's another question here, and I'm actually embarrassed that I don't know the answer off the top of my head. So I'm shaming myself here. Um,
Okay.
in the new system, will the supportive housing application packets be available with the clients after move-in? Because right now, once you move the client into your roster, the application and all the supporting documents disappear.
Yeah, and I actually, I said, I didn't know that either, so you're shaming me as well.
Oh, sorry.
And that's okay. But I sent an email. I haven't gotten anything back, and so hopefully I'm hoping to get an answer from Alethea. I sent an email to her, but my feeling on it, and you can't hold me to this because it's a feeling, is that we address that issue because we are looking at the utility of the system to the providers and being able to access the client information even post-placement. So I know that we reviewed that, but before saying an absolute yes, I would like to, add the caveat that it may, and we're also doing the system in phases as well. Probably 80% is going to be on the day of launch. It is a hard launch. It's going to be, like you won't have access to the old system any longer when we do launch. Right now, the target is October 19th. So I hope that also answers a few of the questions that are in the chat. And a lot of people are saying some nice things about the to me personally and on the presentation, and I'd like to say thank you for those comments. But let's see if we can find some more questions to answer in the chat related to the function, and we can clarify. Does a large number of refusals affect a client's prioritization? That's an easy one for me. No. I think what that impacts is, which this does happen, we have heard from people working with folks in the shelter that sometimes people want a specific type of unit and they do turn down a lot of the referrals that are made on their behalf. And so that I do feel is largely an engagement issue that needs to continue to be worked on with the client. But in terms of the system, it does not impact the client's prioritization. But I do think that they look at people who have gotten referrals in the past and not people who have not gotten referrals. And, so that might play in that way, but not in terms of like official prioritization, right? It's just like, it really is, more about who hasn't gotten a referral at all in the system, which there can be many at certain points of time. So I hope that answers Kenneth Cooper's question. There are more questions. Oh yeah, Elizabeth confirmed with me. She said DHS contracted SRO. No shame, y'all. Okay, thank you, Elizabeth. We appreciate that. Okay, I did get it right. Okay, I interpreted that right. Okay, so that will working towards no duplication of effort here. So, and you can certainly reach out to, Trisha Dawson or Karen Clary, whoever is your contact at in Jennifer Kelly's shop to, with further questions on that process, okay? I'm sure they will welcome that. And then if a client has completed an HRA packet, can I view it as if it was done by someone else? So I will just answer this generally and hope I get it right. If you do a survey, so you're in the system and your client matches on prior supportive housing applications, you will be able to view all the documents in that packet. That is all the documents. That's the determination letter. That is the summary of the application. That's the psych eval, the psychosocial housing documents, all of it. You will be able to view that. So the other part of that is, you know, that I wanted to mention is that we had a slide on that now in the new system, those type of documents will be readily available while you're completing, if you need a new application on the client. Now, we have had the rare case where somebody has had an active approval on their supportive housing application. And in that case, you can act on that that housing application, that approved housing application. Even though you weren't the referring agency, you can still act on that if you are currently working with the client. So I would encourage that. If you feel that, that your client is eligible for a different category of supportive housing, depending on the setting the client is in, you may make the decision to submit a new application in that case. All right, so we have.
So I'm going to answer a quick question about TADs, if
Sure.
that's okay, Craig.
Sure.
If there will be any changes to the TAD report, it will be more fabulous. There are more components where you update your unit roster, your referral roster, and your tenant roster. Those are your three best friends in the new system. But overall, it's the same process, right? You're verifying that these are the clients that are in your program this month. You're making any changes that need to be made, and then you're submitting it. So the process is the same, though the details are going to be a little bit different. And that is part of the training materials that we are developing right now. So you will have something in front of you to walk you through it for the first time. But it will be fabulous.
Yeah. Somebody asked an interesting question that are there walk-in locations where applications can be completed? And if there are, I'm not aware of that being available in the city. Now, I know there are one-stop shops where people can go in and you know, forgive the term, bundle their services with the provider that is operating that one-stop shop. And any one-stop shop will also have access to our system, because if they are one-stop shop, they're also assisting people with you know, placement in the community if they're homeless. So so I hope that answers that question. But in terms of somebody just kind of walking into a place and completing an application, it does not work that way. It has to be a provider that's been verified by HRA to have access to the system, and then you know, the workers assist the client to complete it. Robin, did you want to say anything?
Well, I did. So I don't know if you just saw that.
Did someone answer the question?
Annika from UCS so kindly offered her email as a resource because at CUCS they have a list of advocacy programs that can complete applications for individuals who are not connected to a program. Right? Because I actually have an email sitting in my inbox asking me this exact question.
Oh, that's great. And I know CUC, I'm not sure if they still operate, but that when I was talking about the one-stop shop, I was thinking of CUCS. So that's really interesting. Because they do, I believe they operate that type of program. And thank you, Anika. That's wonderful for you to point that out to folks. And we use CUCS as a resource so much, and I would like to take this opportunity to thank them, because they do, you know, operate the SPOA, and they are such a tremendous training resource for people who do not have experience with supportive housing. And we make a lot of referrals, even HRA makes a lot of referrals to folks so that they're able to really understand, you know, the system and to benefit their clients. So thank you, Anika. I really appreciate it. There are also, I think there's other, Chris Baden is also saying Brooklyn and Bronx Peer Advocacy Center. So yeah, I think there's a lot of different places. Okay. All right, what else do we have? There's a lot of thank yous.
Yes.
I appreciate all the thank yous, and yes, so.
There was one very specific question that came up while you were presenting. And for the person who asked the question, please correct me if I butcher it. But with the new professions that are now available to do the psychiatric eval, does that mean that NPI number is not required in order to submit? And if the eval is missing that number, will the system reject it?
So I took I don't know what the NP, I thought when I read that question, I thought it was, they were saying like is that an abbreviation for nurse practitioner? I'm not sure. But here's the deal. So there's only one profession that we now require a cosign, and that is the LMSW. You need a cosign because they are not advanced enough in their competency, in their licensure, in order to complete a psychiatric evaluation. So they still need a cosign. All the other professions can complete the psychiatric evaluation, and they will, yes, they will need to provide their license number in the system, but that's as per usual. That's for all the licensed professionals. But we really moved away from having a cosign unless it really was necessary in terms of, you know, kind of their competencies and how the New York State Education Department, we did a lot of research on this. So we did not take it lightly, changing this policy. And we did a lot of research. And so that was the only profession we felt needed a cosign from, you know, either a psychiatrist or an LCSW or a licensed psychologist. You see the professions expanded a great deal. So that's a good question to call out. Thank you, Robin.
There is another question about will all COC programs be required to go through CAPS, whether they're in the system right now or not? And that is a great question. So yeah. The COC is funded by HUD, obviously. The coordinated entry is a federal requirement. It's a HUD requirement. So the answer is yes.
Yes.
All COC programs have been evaluated on their participation in CAPS. I believe it started last year. And again, this year, there will be evaluation questions around CAPS. It's currently not scored, but they will be scored, I believe, beginning next year, but please don't quote me on that. It's either next year or 2022. And so for programs that are not currently in the system, you have the information Craig provided at the end of the presentation on how to set up your agency and your site, add users. And our coordinated entry team is happy to help you get started to get in the system because it is a requirement.
Yeah, and what I would say is, you know, like we're launching the new system. You know, the target date is October 19th as of this time. We're not saying day one, folks. Right. You know, on that you know, involvement in the CAPS, like getting your program into the CAPS system. So we're looking at that as being a long-term goal that does not need to happen immediately. But if we have your information and you have COC units and you're in the system currently, we will be asking for more detail on your units. And then, yes, we will be moving towards a system of hopefully, you know, where we can expand our resources so that we can provide that service to housing providers. Right now, I think it's a matter of resources. is that do we have enough people, you know, to act as placement entities to be able to perform that function for all of the other COC units. It's not insubstantial, right?
Yep.
So, so there's no even target date on that, other than that's something that I believe we have discussed and that we are working towards, but there is no, you know, kind of set plan that we can share that says, like, you know, as of this time or anything like that, right? So it's a to be continued on that, but I hope that provides some clarity around how it's not an objective at this time.
Great.
Just a long range goal. Okay, do we have, Bonnie asked a question, has there been any movement to broaden who can provide documentation of homelessness? Many people who seek out hospitals may not be known to outreach programs, and therefore their homelessness is not documented. I've had this discussion before. It's still pretty much that the, you know, like the gold standard is that the outreach program completes a homeless verification letter. So, you know, I don't want to take up a lot of time in the, you know, we have a few more minutes here to address this, other than to say I'd love to revisit this question with Bonnie and whoever would want to have that discussion again. You know, that would be, it's not, you know, our decision necessarily, but there is an interpretation of what constitutes verification of homelessness. And so we can certainly have that discussion. But right now, really, it's about, you know, homeless outreach providers being able to document that. You know, sometimes it is soup kitchens, sometimes it is the, you know, faith community that may be offering homeless services. And so we do it on a case-by-case basis in those kind of situations. And we do have some guidance on that, on what constitutes, you know, kind of verification of homelessness for the supportive housing application, which we can share with this group. I think it may be on our what's new in the in our system. So we have it posted to our system, but we could share it here as part of this group. All right, are there other questions, Robin, that you're seeing?
I'm looking through.
Oh, Laura just posted the website. Yay, Laura, thank you. the COC website for CAPS.
Yeah, she posted that both. So Craig, I don't know if you're looking at both the Q&A.
No, I'm just looking at the chat.
Okay, so there's some duplication, which is great. I'm just making sure that we're not missing anything that was
okay.
Both.
I'm not used to Q&A. Should we be looking in that?
Well, it's good. You stay in the chat. I've got
okay.
covered. So we have the COC website that's posted. Thank you to Anika, who's going to share the list of the resources for 2010 East in the community. That's fantastic. I don't see any other questions that I missed. There was a few specific ones that I answered rapid fire typing style. If you'd like to resubmit that, we do have a few more minutes. So if there's anything that we missed or didn't get to, we are happy to take that. I think we have about 6 or 7 minutes left. And again, our contact information is right here. I do know that there was a question at the beginning. Beth, I believe it was, posed the question specifically about the DHS Pathway Home Program, enhanced one-shot deals, some of those non-supportive housing resources that Craig, you mentioned at the beginning of the presentation. For clients who are found potentially not eligible for supportive housing, these are the other paths that they could take. And again, that was a really specific question. So Beth, if you want to email us directly, we can answer as best as we can. Whatever we don't know, we could certainly forward you on to the right person. And that's a good resource for us to know more about, right? And as CAPS expands, it was really laser focused on supportive housing for the first couple of years of development, because that's where we needed to start somewhere. And that's where we decided as a community to start. But as we start incorporating more types of subsidized housing, right? Dedicated homeless, some that's not dedicated homeless, right? I mean, we have a really large system. It's going to be really important to include all of these resources into the system. There's a question about HASA units. So New York, HASA units will be in the system. HASA has their own process, right? HASA has their non-New York units that use the NISHA application, and HASA has HASA Web. So unfortunately, for the units and programs that do not have a COC overlay, right? Because all COC needs to go through CAPS. For the HASA units that just require the NISHA application, they will continue to be referred and placed and tracked within HASA Web. I think, you know, we'd all love to eventually get to a place where we have one system that serves every distinct piece of the system. You know, we're a long way from that. New York City is incredibly complicated, and I feel excited and grateful that we've been able to make as much progress as we have with CAPS, thinking about all the different kinds of supportive housing that we're going to have in there for the first time. So hopefully that answers your question.
And Robin, I would just piggyback on, even though you are doing like a NISHA application, and maybe it's kind of a separate process for you, you know, that is, you know, you can still be part of CAPS in terms of doing the survey and, you know, determining the needs of your client. And we are, you know, discussing with HASA currently, you know, ways that for their non-New York programs, because right now it's really New York 3 Pop H, right, that we're talking about, is that for their non-New York programs that they are better integrated into the CAPS system. That is probably also a long-range goal, but we would like to, you know, we would like to address some efficiencies, and you know, so you know, if HASA would like to do that, and we can accommodate that, then that's something that we do have on the radar in terms of, especially for the COC units. You know, because we'll have to figure that out at some point. But we have a big job ahead of us in the near term of launching this, you know, completely redesigned system. And I would say that this is unique to any community in the country in terms of the level of sophistication. And I'm not saying that to pat myself on the back, or this really was a group effort with the continuum, the CAPS committee, all of the stakeholders, and you know, the network has been tremendously helpful to the process as well, for people who, you know, representing the supportive housing world, you know, in that process. And so that will all continue, and we'll continue to make improvements like we do in the CAPS committee. It's an iterative process. In the near term, we'll make sure everyone knows what CAPS is, and that they have the resources to, you know, manage the system, because it does take some work to manage the system, right? As we all know, with each unique system. let me see if I have more comments I may be able to. Are we at time? Oh, we are. We have like 1 minute left.
I did want to take
another
the last moment to really thank the network, thank Tiara
Yes.
and Emily and Joelle, and I'm sure Cynthia and Laura and Rebecca all had some sort of hand in this. And, the network is such an amazing ally of city government and the nonprofit community. So we just want to thank you for this opportunity. And we look forward to, as the system grows and develops, really more of these collaborative events, because we need you to get the word out, right? I mean, your members are our users. We're serving the same people. So we love this collaboration. We really, really thank you for your support and to get the registration out. And so I just want to say a huge thank you. And, no bias here. The network is amazing.
Thank you. Thank you both so much. This was so informative. This will be posted on our website. We'll send out the slides. You can get it in multiple places. Thanks everyone for participating. Feel free to email us. And yeah, we're happy to host more of these as they come. We know that there's going to take a lot of learning and relearning for all of our providers. Thank you so much for pushing this for us. Yeah, we're happy to host anytime.